Good morning. Good morning. Okay, thank you. All right, let's get started. Good morning, everybody. I'm so glad to see all of you here today, and I want to thank South High School for hosting us. Let's give them a big round of applause. So some of you might not know this. One of the reasons I wanted to hold this meeting, this question and answer session at South, is because it's my alma mater. And so, you know, I spent many happy hours on the stage here when I was the president of the, I know you won't be surprised, I was the president of the drama club here at South. And so I always love coming back, and my staff pointed out that I even wore my purple today because the South High colors are purple and white. So anyway, I'm glad that you're all here this morning. This is the latest in the series of listening sessions and question and answers that we have had throughout the Congressional District over the August recess. As you know, we're not in recess anymore. We've been back for a week, and the president came and addressed a joint session of Congress on Wednesday night. I was there. One of the things he said that I like his plan, seeing as it pretty much mirrors the plan that my committee, the committee I'm the vice chairman of, the Energy and Commerce Committee, so I like the plan, but the thing I like that he said is we are talking about completely revamping our healthcare system in this country. And in a way, we hope we'll give quality, affordable healthcare to all Americans. So as we go through this process, I think we can expect to have a very strong and opinionated national debate. And we saw that through August. I think that's a good thing, because after all, this is the system that we all will be accessing with health care. So I'm eager to hear what you have to say. I just want to let you know what's going to be happening this morning, and then we'll just get on with it. I'm going to make a few remarks about how the bill, as it passed through my committee, is pending now, is structured, what it looks like. But then I'm really here to listen to your questions. And we have two I know it's a little dim in here, but we have two microphones here and here. When I finish with my statement, if people can just line up behind the microphones, I would appreciate it, and I know the audience would appreciate it, if you would keep whatever you have to say short, so that as many people as can be heard will be heard on all sides. And I would also, I think what the president said is correct, which is we need to have a respectful and reasonable dialogue about this. And listen, I will say, that all of the conversations that I've had in the district, the telephone town hall meetings, the actual question and answer periods, everything we've done has been respectful here. And I think that that's a real testament to how wonderful my constituents in the 1st Congressional District are. So thank you to you for a good dialogue. Let me just set the stage for what we're talking about and why Congress and the White House feel that we so urgently need healthcare reform in this country. As you have probably heard by now, in the United States, we spend twice as much as any other country in the world on our healthcare system. But the results that we're getting are far below where we think we should be. When we look at healthcare results as estimated by the World Health Organization, we rank very, very low on a whole number of indices. And in fact, we're just above Slovenia in healthcare results in this country. And frankly, we pride ourselves on being the trendsetter for the entire rest of the world. And because of this cost, and because it looks like if our healthcare costs continue on the same trajectory, we're going to be spending a vast percentage of our gross national product on healthcare costs by the year 2018. Now, many people ask me, why should we be trying to address national health care reform just at the time we're trying to come out of the worst recession in our lifetimes? The reason is, in the short and the long run, we are not going to be able to remodel our economy to be competitive in the 21st century if we don't bring these skyrocketing healthcare costs under control. And so that's what we're trying to do with this bill, as well as the simple fact that we have over 40 million people in this country who don't have health insurance, who can't take their kids for preventative checkups, who have to go to the emergency room when they get sick, and who really don't have the kind of health care that we think every American should have. And so, here's a young American maybe unhappy with our health care system right now, I don't know. But it's a system that is untenable either from a healthcare standpoint or a financial standpoint as we go forward. So the concept that we have when we're trying to think about how to restructure our healthcare system is what can we do to make it work for every American. So before I go through this speech, and I'm sure many of you watched the President's speech the other night, but I'm going to hit on some of the key parts of the bill. Since most Americans are currently covered by some kind of health insurance, we let people stay in their health insurance plans, and we let employers continue to offer those health insurance plans for people. But what we say is, you cannot discriminate against people because of a pre-existing condition. You cannot eliminate coverage for that or drop someone from their health insurance. This is for everyone. Secondly, we eliminate the annual or lifetime caps for coverage. So if you get into a terrible car accident or you get a life-threatening disease, you won't be made bankrupt because you're trying to pay for your health care costs. And the third thing we do, and this applies to everyone, is we say, you can't drop somebody from health insurance coverage simply because they lost their job. They can continue in their same health care plan. And we do this because we think this will be the best way to keep people in their insurance and to keep the insurance companies covering people for their real health care costs. Then the other thing we do, and I think there's been some confusion about this, and this is why I like to try to explain it to people. So if you like your insurance, you can stay in your insurance. If your employer's offering your insurance, they will be able to continue it, but with the caveats I talked about. For everybody else, then, we set up, you've heard about this now, the insurance exchange. And what this insurance exchange is it's basically a marketplace where insurance companies, and then in our bill, we have the public option, is they will compete for people to sign up. So for people who don't have health insurance, they can go into this exchange, they can choose the insurance that they wish to purchase in this exchange. And they can choose to buy from a private insurance company that's competing in the exchange. They can choose to buy from the public option, and I'll talk about that in a second. Thank you.